Hi. Ooh, that's loud. For me, anyway. I'm Eloise Stager. I'm just going to talk a little bit about craniosacral therapy. What you guys just heard in the last couple of presentations is really a nice segue for me. And so let's just get started. I'm a licensed massage therapist, and all I do is craniosacral therapy. I have my diplomate certification through the Upledger Institute of Craniosacral Therapy, based in Palm Beach, Florida. They train therapists all over the world. So here we go. I don't have anything to declare. I think we have maybe some wrong slides, but that's okay. This is me. These are just my symbols. This is my practice, Connecticut Center for Craniosacral Therapy. I'm in Connecticut, just on the New York line. I developed a program for manual therapy training for other allied health professionals called osteofascial integration, which is specifically geared to working with people with hypermobility and Ehlers-Danlos syndrome, HSD. These are my wrong slides, by the way. But anyhow, we're going to keep going. My global goal is that everybody has an EDS HSD literate manual therapist anywhere in their community. So that is my personal goal. We'll see how this goes in the next 10 years or so. And we're going to talk, I'm just going to briefly talk about my practice metrics. I'm going to give broad strokes of craniosacral therapy. And if I have time, I'll give you just a couple of little tidbit tricks to do for yourself at home. So here are my practice metrics. I have a mixed practice. I see a lot of different people. Most of the time, these people come to me and they're already desperate. They're physicians, physical therapy, whatever, have no idea what's happening with my clients. So my clients end up coming to me. About 70% of them have Ehlers-Danlos syndrome or hypermobility spectrum disorder. All of them have pain in some way or another. So oftentimes I see headache, sacroiliac joint pain, temporomandibular joint pain, acute pain, chronic pain, and of course, fatigue, which is why not. So and one more little, are you guys doing this? I'm not pushing these buttons. My age range is about 17 to 72. That's my EDS client population. So I have a really broad spectrum, even just of who I'm seeing. All right, back to broad strokes. What is craniosacral therapy, right? These lights are in my way, but who's heard of it? Raise your hand if you've heard of it. Nice. Stop advancing. What is happening? Maybe I'm doing that. Okay. Who's had it? Who's tried it? Okay. Of the people who've tried it, did you get benefit from it? Okay. What are you guys? I got my notes now. Oops. Okay, I got my notes now. That's so funny. All right, I don't know what's happening with my slides. Great, fine. So, okay, how many people have heard that it's only energy work? That it's energy work? Ooh, that's really, really good news because it's not energy work. It's structural, functional work. Okay? We consider this is a light touch, very light touch, manual therapy. It has osteopathic roots. So its genealogy starts back over 100 years ago with a guy named Stills. It moves forward to a guy named Sutherland, and then we had Upledger. I'm not going to go into the history of these guys, but that is kind of the genealogy here. There's a whole body approach. This is the essence of whole body functional medicine, whole body structural work. So my key areas of integration here in our work is that we're going to look at structure and function. We look at reciprocal tension or tensegrity in the body. We look at the autonomic nervous system, and we look at the dural membrane system. I'm going to go through that a little bit. And then the integration of the mind, body, and spirit, and how that works together as a whole. So we're not just talking about body, we're not just talking about body work, we're also integrating how that affects our whole mental, psyche, emotional body as well. We work closely with something called the inner wisdom. This is unique to upledger craniosacral therapy. We work with the body's wisdom all the time. As I mentioned, John Upledger is the founder of craniosacral therapy. He says, every treatment protocol should be dictated by the wisdom of the patient's own body. That is a key component of our work and philosophy. Without this, we're doing things to a body versus working with the body and allowing that body to teach us as therapists what it needs in that moment in time. So let's talk about some of the structures involved. We have the cranium and we have a sacrum. Going back one. Obviously, cranium. Sacrum's this red circled bone. It's at the base of the pelvis. You guys have already seen a lot of anatomy in the last couple of days. Sits between the pelvic bones at the base of the spine. So craniosacral therapy is quite literally head to tail in its name, but it is a full body function treatment because we are very interested in how all of the other parts of our body connect and integrate with that central core aspect of the body. Within this space between the cranium and the sacrum are the dural membranes, which are specialized layers of tissue that are under pressure, that have cerebral spinal fluid in them, and are subject to issues of compression, shearing, torsion, impact, vibration, things like that. So now that those membranes adhere to the cranium, and they adhere to the sacrum. So when I place my hands on someone's head, I am in indirect contact through that dural membrane system all the way to the tailbone. Within this dural membrane system, the cerebral spinal fluid changes pressure a little bit. So this system's under pressure. Teensy tiny bits of change of pressure, normal changes of pressure. It happens to everybody. While you're sitting here, this is happening. So when that shift in pressure is about changes every 3 to 6 seconds, so that you go through a full entire cycle, about 6 to 12 times per minute. We call the widening phase, there's a widening and a narrowing, we call the widening phase flexion. This is different than a joint flexion, okay? So our language is a little different. But the pressure increases, we go into flexion. There's a widening and also a general shortening of the entire body. And then also the limbs externally rotate, and then opposite of that, in a decrease of pressure, our limbs internally rotate. Our body narrows and lengthens a little bit, and we call this extension. I kind of do wish that I could stay in that longer and be taller, the extension phase sometimes. But anyway, so we have this rhythmic happening of flexion and extension every 3 to 6 seconds. What I'm looking for when I'm taking an assessment of this as a whole body treatment is I'm looking for characteristics of this flexion and extension. I'm looking for something called symmetry or synchrony and or asynchrony, quality, amplitude, and rate. When there's an area of disruption within the body, these characteristics aren't equal. So if there's an issue with a left shoulder and that person is naturally going into flexion, the right shoulder might go into a better rotation and the left shoulder might be a little stuck. Okay, so I call this, it's more of a disruption. Sometimes in our languaging, we would also say restriction or tension. But when we're talking about Ehlers-Danlos syndrome, we can also have hypermobility and instability and laxity. So it's more of a disruption in the system than always being a restriction, although there's often that dichotomy, right, of having it too tight somewhere and too loose somewhere. Nice potential benefits. The biggest one is that it supports the autonomic nervous system. So I already heard some people talking about dysautonomia and how dysautonomia affects the body. Craniosacral therapy can help regulate the autonomic nervous system. So all those things that are autonomically related to you that you're experiencing might be able to be addressed in an extremely gentle manner through craniosacral therapy. One of our fundamental principles is that structure and function are interrelated. They're reciprocal. You cannot have one without the other. And so then in zebra families, we have a fundamental difference in that structure. So therefore, a fundamental difference in its function. And therefore, we have a fundamental difference of what we find in the craniosacral system. Some of the differences include that quality I was talking about, the symmetry, synchrony, quality, amplitude, and rate, those characteristics will seem a little different. So the craniosacral quality feels very, very, very light, delicate, and smooth. The reciprocal tension, the tensegrity in the body, that balanced tension, is lax. So it does not respond in the same way. Obviously, we know proprioception is an issue, but that's because of the structural integrity of our connective tissue. Biomechanics also affected by that. And joint spaces, so our mobility in our joints, they just don't feel collected sometimes, right? Would you agree with that? We feel a little loose. And of course, we have all these central nervous system comorbidities, which have just been discussed at length. If you happen to have any of those, make sure you tell your craniosacral therapist. So because we have these fundamental differences, we also then have to have a fundamental adaptation to our manual therapy, whether that's craniosacral therapy, physical therapy, occupational therapy, Rolfing, massage therapy, all of that has to have a fundamental difference in treatment. So from my perspective, I'm always following the body's wisdom as per my training with the Upledger Institute. By touch, though, is going to be lighter. So a typical touch in craniosacral therapy, we say 5 grams. That's the weight of a nickel. That's it. That's where our touch goes. That's the weight of our hand. But in EDS, I might use even less than that. 2 grams maybe, okay? And then I always protect the hypermobile joint. I protect the fascia so that it doesn't accidentally lengthen too much during a treatment. And I protect the neck because we have craniocervical instability, atlantoaxial instability, Chiari malformation, and the list goes on, okay? But that doesn't mean that we can't also offer some craniosacral therapy, but the techniques sometimes do need to be adapted. I wanted to say, of these common things that you guys have, we have, right? Temporomandibular joint issues, sacroiliac joint issues, post-concussion. Also, I'm sure a lot of you here have had concussions. Any spinal curvatures, unstable joints, tethered cord, and Chiari. All of those can be categorized into connective tissue disruption. The structure isn't there. The tensegrity isn't there quite the same way as for somebody else. So then we tend to be more susceptible to these things. This is another, I think I saw someone yesterday or today go, duh, right? So yeah. So here are just some of the things you guys may see, right? We sometimes see the cerebral spinal fluid leaks, aneurysms. I mentioned Chiari several times, syringomyelia, craniocervical instability, and intracranial hypertension, there are others, right? So if you have any of those, you have to talk to your craniosacral therapist. Let them know. One of the things I also want to bring up is that when we have a connective tissue disruption, then that causes us to oftentimes modulate and adapt in our biomechanics, right? And then sometimes that leads to more dysfunction, and then sometimes that will lead to pain, which then leads to us modulating and adapting our biomechanics again. So we get into this loop. One of the things craniosacral therapy can do is break that cycle, because it can help reduce the pain by helping the autonomic nervous system modulate it a little bit better, and you're not as jacked up all the time. So we tend to maybe be in this fight or flight often in the autonomic nervous system, and that tends to also hype up our pain. And if we can break that cycle, then other modifications can be more effective for you instead of a dysfunctional pattern. When we're in this pattern, however, then we have a mind, spirit, body, triad. How is that affecting your quality of life and how you're feeling about things, your general overall wellness? These are things I think about with my clients. How is everything? I spend a lot of time with my clients, talking to them, checking in, listening. I heard some other practitioners talk about that, listening. So I listen not just with my ears, but with my hands, and to their inner wisdom and my inner wisdom. That's that body's wisdom. I already mentioned that you got to let your practitioner know, because some things may be adaptable techniques. And Hippocrates says, I love his quote, I love this quote, everyone has a doctor in him or her. We just have to help it in its work. The natural healing force within each one of us is the greatest force in getting well. So my practice role, my therapeutic role, I told you what it was. How do I work with it now? In 5 minutes. I'm going to tell you. I find and facilitate this release of disruptive tissues. How do I do that? I assess that craniosacral rhythm, that flexion and extension, and how it is reflecting in the other areas of the body. Am I finding it equally somewhere, or is there a hiccup someplace? Is it not reflecting the same way? I put my hands on the body, and very lightly, 5 grams or less. And I just wait. The body's going to show me what it needs. I know for some people that might be like, well, how does it do that? I don't actually do anything. I put my hands on a body and I wait, because with a little bit of pressure, a little bit of time, and the heat from my hands, physics simply says the tissue is going to change. That's it. I wait for the change, and it's going to change only as much as it needs to change. And when it changes, it might feel a little differently. I can disengage. I move on to the next spot. So therapeutic result, those connective tissue disruption patterns can improve. The resiliency to adapt to stressors through the nervous system can improve. Also the biomechanics and just the body resiliency, your energy, any anxiety that comes with it, brain fog, cognition, those things can improve. Structure and function improve. And the nervous system, I already mentioned, improves. So one of the nice things about this, dural membrane system, cerebral spinal fluid stuff, flexion, extension, internal pressure. During craniosacral therapy, we're engaging with that system. And so we do have the capacity to help the cerebral spinal fluid maybe traverse a little bit deeper into its systems, so that it's supporting the brain a little bit better and supporting the spinal cord a little bit better. So that will help you reduce some pain. That was the whole point. Craniosacral therapy can help with pain. I'm sure there are more questions now than I have answers for. And I am going to end this here. So in a nutshell, we gently encourage the release of any disruptions in connective tissue that might be adversely affecting the central nervous system in general. We allow the freedom of the nervous system to self-correct. We give it that time and space. thereby supporting all of the systems to self-correct, which supports the structure and function of the entire body. All right, and that does it for me. Thank you.